My name is FELIX MUTUA, Head of Department Clinical Medicine and Surgery. I have programs, two programs in our department. That is, I have a diploma in clinical medicine, and we also teach higher diploma in clinical medicine. For diploma in clinical medicine, usually takes 3 years. 3 years is the time for the college. After 3 years, you do pre-internship exam for the Clinical Officers Council registration, and then from there you are posted for internship, which is 1 year mandatory for internship. Then the key modules in the diploma in clinical medicine, we have the basic sciences and also the applied science, the clinical sciences. The basic sciences, of course, are the ones which prepare the students for the clinical practice. And during the basic sciences, we also introduce you to skills lab, which is part of the practice. And that is in first year. From second year, then we give you clinical sciences, which prepare you now for the practice. And in those ones, we place you in the wards for clinical placement. This takes every day. It shows that you have to attend for clinical practice from second year and third year. The mode of study is usually full-time, and now we are encouraging mixed learning, that is face-to-face and e-learning. The placement areas usually place our students in the wards, in the referral hospitals, either the national referral hospitals or the county referral hospitals. We also place them in the community hospitals, that is the rural practical sites, where they are engaged in community practice, in the public health institutions, for example, in the manufacturing, the plant and manufacturing. They look at how preparations are done in manufacture, in the factories, and also in the slaughterhouses. Water and sewerage treatment sites, they also go to those sites. And also they also do market surveys. The school fees for diploma in clinical medicine usually have fees paid per semester. We have 40,000 per semester. So semesters are usually 2. That is amounting to 80,000 shillings as tuition fees per year. And of course, you have said is 3 years in the program. The job description, these clinical, they are called clinical officers, and their role in the health sector is usually curative, where they are able to diagnose, after diagnosis to prescribe, and also to treat. They are also able to do promotive science, where they usually give health education to the community, to the care clients, and also give preventive health, where they give information on preventive care of diseases. And again, they also do rehabilitation, where they are able to do physical rehabilitation, mental rehabilitation through counseling and psychosocial care. And those are some of the roles which a clinical officers play in the healthcare. After graduation, these they are usually registered by Clinical Officers Council after doing their pre-internship exam, and also after doing 1 year mandatory internship, where they are posted by the Ministry of Health to mostly the referral hospitals. And they can work in the referral hospital, that is in the national government. They can work with the county government. They can work in faith-based organizations or community-based organizations. They can also work in private, where they can be employed there, or they can open their own self-employment practice, where they can earn their living. And the academic progression for a diploma student, you can progress to higher diploma, which we have various higher diplomas in Kenya Medical Training College. They can also join universities to do bachelor in clinical medicine and community health, or they also can proceed for master's program or even to PhD, which we are hoping in the soonest. We work with many partners. I know majority of our students are catered for in the payment of fees, and also taken care in the issues of tuition by some partners. We have the national government through the Higher Education Loan Board, which is giving loan to our students, and also the county development funds in the constituencies, and also other donors and who assist our students in the teaching and learning. So we call upon students to join KMTC in the Department of Clinical Medicine. Secondly, I want to say that we also have higher diplomas in clinical medicine and surgery. We have various programs. We have programs, for example, pediatrics and child health, which deals with diseases of children, which currently is a 12-month program, and is trained in Kisumu and in Nairobi campuses at the moment, where we are admitting 20 students per campus. We also have anesthesia. Anesthesia is in 8 campuses. It takes 18 months. The campuses are Nairobi, we have Thika, we have Embu, we have Nakuru, Eldoret, Kisii, Kisumu, and Mombasa. And we are admitting around 150 students per year. And we hope to continue to admit all our former provincial hospitals, the campuses in our former provincial hospitals. We also have emergency and critical care medicine, which is based in Nairobi. And this one, the clinical officers trained in emergency and critical care, and is taking 18 months. We have oncology and palliative care, which is currently in Nairobi. We are training students on management of cancer and the care taken to the patients who are suffering from cancer. We also have dermatology and venereology. It is relatively a new program, and it is also 18 months, based in Nairobi campus. We train students on issues of venereal diseases and skin diseases. We also have chest medicine. Chest medicine is also a relatively new program for 18 months, and we're able to train people on TB and other chest infections. Programs like reproductive health in Nairobi and the Thika campus. We train students on reproductive health issues and also reproductive health surgery. Other programs are orthopedic and trauma surgery, and the students are trained on management of trauma emergencies and also rehabilitation. Other programs, ENT, head and neck surgery. We train the students on ENT diseases and neck and head diseases, and we also train them on surgery on some parts of the head, neck, throat, and the ear, nose, and throat. We also have audiology and hearing care technology, where we are training people on how to make gadgets for the people with hearing loss or deficiencies, which is a relatively also a new program. Other programs are ophthalmology and cataract surgery. We have an ophthalmology laboratory where we train people in surgery, actually cataract surgery, and KMTC is the only place where we are training cataract surgery as a higher diploma in the country. I know other people have been trying, but I think we are the people producing the highest number of the graduates in cataract surgery. And I think those are relatively. We also have mental health and psychiatry, which is based in Mathare campus. It has been a 1-year program, now it's moving to 18 months. And also the demand is also high. We also have addictive sciences in Mathare, which is based on Mathare campus. We train people on management of substance and alcohol abuse and other kinds of drug abuse management. We also have a higher diploma in family health, which is a 18-month program, which was introduced in 2018 because of the issues of UHC through the Ministry of Health. So those are the programs we're having for higher diploma. We intend to open more. We intend to start a higher diploma in nephrology because of the issues of the kidney diseases which is coming up. And we also have want to start other programs in cardioperfusion, which deals with the perfusion of the heart and the lungs, and is also a program we are looking at. We also think about introducing speech therapy, which is a new program in session. Yes, so those are the higher diploma programs which we have, and the ones we are introducing very soon. The programs are running for 18 months. Apart from pediatrics and addictive science, which will convert soon to 18 months. The modules we usually have, these are technical subjects. They go through technical modules, which are basic sciences and applied sciences. There are more technical things which they do because it's hands-on practice of their diplomas. For someone to join higher diploma in clinical medicine, you must have done a diploma in clinical medicine. Or nowadays we also agree when you have a bachelor in clinical medicine, you can join these because these are highly specialized field in medicine. So we encourage people who have, and they must have been registered with the Clinical Officers Council. So they must have a current private practicing license from Clinical Officers Council to be allowed to pursue higher diploma in clinical medicine. The mode of study is actually full-time, face-to-face, and mixed e-learning and face-to-face. Those are most preferred because these are highly specialized. We teach them face-to-face and we take them to the clinical setup. Basically, their work is more clinical-based. And the placement sites is referral hospitals, and also either the national referral hospitals or the county referral hospitals. Sometimes we, like the ones doing dermatology and venereology, we place them in the leprosy, the sites where we have had leprosy, like in Lupe, which is a county referral hospital in Busia, or we take them to Musambweni. But mostly we take these students in the county and the national referral hospitals. Job description, these are clinical officers, either clinical officer anesthesia or clinical officer dermatology and nephrologist, or clinical officer reproductive health, depending on the specialization which they have done. So the fees paid per semester for higher diploma is 60,000 a semester, which takes 6 months. So the semesters are usually three for higher diplomas, and that one makes a total of 180,000 shillings. So where they work in after graduation is they usually work in specialized areas, in specialized clinics, in casualty, and in theaters. Those are where they are based in. In family health, the clinical officers, they work in the community, in the families. So they work from the hospital to the family. Because this time, because of UHC, we interested in providing health care to the families. So they move from the hospital to the patients in the community. Clinic officers specialize in family health. Their work is they see patients in the hospital. They are able to follow the patient to the family setup. So they are able to diagnose, if they diagnose a condition, they are able to follow you to your family setup. And also they are able to see how many people in the community have the disease and see how they can transform the healthcare from the family setup, the community setup, so that so that the people they can be able to reach each and every a person with an ailment who is sick. So that is what they do, and that is the program now you want to bring on UHC. The academic progression from my diploma, you can move to a bachelor in clinical medicine. You also move to a master's program or even the PhD, which we want to open in some universities. We have already, we know we have pending collaborations with universities to start PhDs. So we start with the bachelors, can move to masters, and also they'll be able to move to PhD. But we are planning to have short courses in clinical medicine and surgery, and one of the reasons why we need these short courses is for people to be updated on the current management of specific cases. For example, we need to have a short course on cataract surgery, which will take 6 months, so that we have people who did general ophthalmology and they want to come back for cataract surgery, or they did cataract surgery and they have not been able to operate, so that they can join our class for revision and they'll be able to be trained on cataract surgery. We also are planning to have a short course on regional block, regional anesthesia, where we want to train those who have done a diploma in anesthesia for 6 months, so that they can get the knowledge on regional anesthesia. We're also planning to have a training on ETAT for those who have done pediatrics as a short course. Another short course we want to introduce is basic life support and ACLS, that is advanced cardiac life support. So those are the short courses which we intend to have to start. And because of the surge of non-communicable diseases, we also need to start a short course on NCDs, which will be done here in Nairobi. So basically, those are the short courses we need to start here in Nairobi. Then they can be rolled out to some of our campuses outside Nairobi. We are working with several partners for our diplomas. We are working with the government of the Netherlands in the audiology and hearing care technology, where they have provided teaching aids, teaching laboratory for our students in our diploma here in KMTC Nairobi. We're also working with the Fred Olos, which is a partner in teaching, and they have been able to get us a laboratory where we are able to, and machines where you can operate the eye. We are also working with the USA to make an assimilation laboratory for anesthesia. And all these partners have been able to pay fees for some of our students in our diplomas.